Well, my thoughts are this. That's a very, very personal decision. And I would tell anyone, including my patients when we have this conversation, that it really depends on a number of things. One, I think it's important that you have tried managing your weight via other means. And most of the time, when patients come to see me, they've done any number of different commercial diet plans. They've tried diet and exercise a number of different ways, often hiring people to help them, and they've still had difficulty losing weight or they've gained weight throughout that time period, on average. And so when we talk about surgery as a means, as one of these definitive, what we call physiologic treatments, you'll hear me say that time and time again. That's because it's treating the actual biology that's supporting the weight gain and weight promotion. That surgery is really reserved for people who have a lot of health risks and related to their weight and their excessive weight. And so that's really what surgery is reserved for. Now, it doesn't mean that you won't be a good candidate for surgery. You very well may be. But we acknowledge that it is surgery. It is an appropriate treatment and a very effective treatment in that way for many people. So I think it depends. That's why you need to talk to a specialist to figure out if surgery is right for you. I will say there is occasionally I have conversations with people who are like, I want to have surgery, and they're not a good candidate for surgery. And so sometimes it is about setting expectations on who is a good candidate and who isn't, based on what we know. And sometimes it's not even up to us. We may even think that you as an individual are a good candidate, and it's up to the insurance company because they're the ones paying for it, and it's an expensive procedure. Either way you look at it. So whatever surgery you get, almost always you're having to have the insurance backing before you can proceed. And I've talked to a number of people on TikTok who said, listen, I had the surgeon tell me that was a good candidate and I got denied. And so that's an unfortunate situation. So, yeah, I think there are a lot of factors that depend on that, but it hopefully gives you some more insight into how I look at it. Probably the safest that we know about would be probably sleeve gastrectomy. So that is the least in terms of least intensive in terms of the anatomy that's modified. It basically just they cut out a portion of your stomach and sew back the existing portion and reconnect it, reanastomose that existing portion to your esophagus. And so you're not having to really change a whole lot. You're just kind of shrinking the stomach size. That's kind of the biggest thing, making a much smaller pouch. So, that's the safest, but I mean, even the Roux-en-Y is very safe as well, if you look at the data. So, but if you had to say, the sleeve would probably be the safest for someone who is considering that based on safety. Unfortunately not. Usually if you lose like 100 pounds or more, you're going to have some degree of loose skin. And that doesn't matter how you lose it. It's really hard. Um, if you were able to lose it at a snail's pace, maybe you would stretch the skin less, and so there would be maybe less loose skin. Most people aren't going to want to do that, and they're going to be. I mean, if they're able to lose 100 pounds, they kind of. I mean, that's the most important thing, and they'll deal with the loose skin afterwards. But I know it's a big issue with a lot of my bariatric patients who have lost 100, 200 pounds. Then they have to deal with the consequences, and so they often have to get another surgery to deal with the loose skin. So that is an unfortunate side effect. But I have to tell people, of all the problems to have, it's one of the good problems to have at that point. If you've lost enough weight where your skin is loose, that means, you've made some incredible life changing progress in that regard. Not everyone loses the amount they hope to lose with surgery. That's an unfortunate reality. For many of those patients, I see many of these patients in my clinic. They've already had surgery, and we try to find other options for them. And that's where medication can be helpful. If you're someone that who did respond but didn't have a complete response to surgery, medication can be really helpful that way. But some people have to have a revision on their surgery, so I'm also sensitive to that. We do both at my weight loss center. So the surgeons, my partners, they do both sleeves and bypass. So it just depends on, your surgical. It depends on the consultation, what they think you're a good candidate for, what your goals and hopes are in terms of your surgical outcomes. So bypass typically leads to about 10% additional weight loss on top than sleeve. So if you look at the 5-year outcomes, sleeve results in about 20% weight loss on average, and bypass results in about 30%. Hair loss after surgery can be due to nutritional deficiencies. So I talked about that. Iron can be one, vitamin D can be another. So make sure you're not nutritionally deficient. It can also be due to just the stress, the acute stress of the rapid weight loss. So the acute stress that it has on the body of losing a ton of weight very quickly sends the hair follicle into sort of stress mode, and it dies. It will come back. So that is reversible oftentimes if it's just related to the stress of the hair follicle. If it's due to a micronutrient deficiency, it's reversible, but only if you supplement. So you have to identify and supplement. There's nothing that's permanently, there's not like a permanent hair loss effect per se. If you have permanent hair loss, it's probably due to some other problem, you know, um, like an alopecia or a hormonal type that promotes hair loss. So, but surgery, it's related to the rapidity of weight loss.